is going to look like. So basically, I'm going to introduce our special guest today in just a minute. And I am going to use him as obviously our content expert in relation to our topic today. And we're going to do an interview portion, which is about 35 minutes. After that interview portion, the plan is for Christina to unmute, and we'll have a little bit of time for some questions and some wrap up as well. So Dr. Mendoza, I'm going to read his bio and then give a little bit more information and background as we lead into the interview section. Dr. Mendoza did his internship, residency, fellowships, and chief residency at Harvard Medical School. He is board certified by the American Board of Psychiatry and Neurology with subspecialty board certifications in addiction psychiatry, geriatric psychiatry, and psychosomatic medicine. He is a director of system integration at the BIDMC Department of Psychiatry, chief of psychiatry at BID Plymouth, and the director of psychiatry at BID Milton and Needham. He's the assistant clinical professor of psychiatry at Tufts University Medical School. His areas of interest include neuropsychiatry, neuroimaging, general hospital psychiatry, addiction psychiatry, psycho-oncology, psychiatry in primary care, and telemedicine. Dr. Mendoza is incredibly interested in community health and wellness, and when colony-wide Plymouth reached out and proposed the idea of doing this webinar to me and asking for some supports in coordinating it, my first automatic response was to reach out to Dr. Mendoza. He's a mentor to me personally, but I have a professional experience with him. And I reached out to say, this is what they want to do. Do you have any recommendations or ideas on how we should structure it, or the content, or some other questions that might be relevant and important? And his response was, that's a great idea. I'll do it with you. And that's a direct quote. And I think needless to say, it's a real treat to have participate in this. We know you're incredibly busy, and really value having your time. So thank you so much. So I'm going to start with the interview and start asking some questions that are important and relevant. So one of the things that Christina had mentioned early on is that
we can't get it.
The social isolation is varying between generations, and I think that's really something important to be paying attention to. And my first question is, Dr. Mendoza, can you talk a little bit about that, about how the impact of social isolation
mute ourselves so they don't hear us.
Right. How it is specific to the senior population?
We hear her.
Thank you, Jen, and I'm glad to be here, at least virtually. Now, every generation will be affected by social distancing and isolation. The elderly are particularly vulnerable, especially if their routines are disrupted. You probably know elder folks, parents, grandparents who are set in their ways, and that is something that keeps them going. It's very disruptive to their routine if somebody happens to just change one of their appointments. Now, their world is contracted to begin with, and any loss, any disruption of their existing social networks can be devastating. The other thing is a lot of elderly are not as facile with respect to using technology and online social networking to reach out to family, friends, and as such, they rely on the same old routines. I have a friend who is in his late 80s, and he'll go to the club, the health club, every single day at the same time, whether it's a blizzard, whether it's sunny, he'll go to the gym at exactly the same time. A lot of my friends go to the VFW, they go to the local pub. As you can imagine, none of this is happening right now, and they're like ships without a rudder. Now, speaking about the routines themselves are critical to ensuring that each day starts off in a nicely predictable way. They make and drink coffee at the same time, they read the papers, they drive to meet their friends for lunch. These routines are meant to decrease anxiety, due to the structure and predictability that they provide. Lastly, not seeing children and grandchildren is a profound loss to the elderly. Seeing them and not being able to hug them is also a form of deprivation. I had a phone call from a friend of mine whose daughter just gave birth to his first grandchild this morning at the BI Deaconess Medical Center. And he called me because he was ask me if I could find a way for him to sneak in to the hospital just so he can hug his daughter and grandchild. And it was sad, but I had to tell him, you can't do that. Now, why is hugging such an important part of human behavior? Well, there's this hormone oxytocin that's secreted by the brain. It's known as the cuddle hormone or the love hormone. And it's secreted whenever people cuddle or hug. And this leads to a soothing and calming sensation. Unfortunately, if you're alone, if you're isolated, there's no hugging going on. Those who have pets can benefit from hugging or petting their dog, as this too can lead to an oxytocin release. But I'm telling you that there are many of my friends who are widowed or widowers who are struggling with this lack of physical connection. The last thing is, even for a physician like myself, and I was just running a support group for physicians this morning, it's painful for us not to be able to touch our patients physically, to examine them. In the era of telemedicine, which is fantastic, because it affords us a way to still help in mitigating the disease. The loss of the touch is important. This physician mentor friend of mine had told me that the elderly rely a lot on the touch of their physician. It's relaxing to them. It gives them validation. And in fact, a few weeks ago, probably almost 6 weeks ago, my last face-to-face contact with one of my cancer patients ended with the patient telling me, "I feel so sad that I can't hug you. Every single time I see you, I hug you and I feel better. Now I'm just going to have to tap your foot with my foot." And there was this profound sense of loss as she said that. So hopefully I answered the question well, Jen.
That was a very profound, comprehensive answer. I appreciate it. So you did a nice job of overviewing some of the challenges. What do you think the impact is? So in terms of mental health or overall health, how does that show up in the day-to-day? You had referenced anxiety, you had referenced some sadness with the patient you just described. What can this look like so that people can try to have some sense of whether or not their behaviors are something they should be tending to?
So if you remember that friend of mine who's in his late 70s, the first thing he does is go to the club after having breakfast. He told me about feeling that he's locked in and feeling like there's no sense of purpose in his day. He starts thinking, maybe I should just sleep in, which is something that he never did. But he started doing that. And as he slept more and more, he would wake up at 10 in the morning. And then this would lead to him not being able to sleep at the usual time at night. So he'd start sleeping at 1 in the morning. So this is what you call phase delay. He is delaying the onset of sleep because he's sleeping in. And this is very disruptive to his sleep cycle. The other thing that some of my friends have started doing is they started sleeping at 7 in the evening. So they're phase advancing their sleep. But the problem with that is they start waking up at 3 in the morning. And one of them told me that his wife got very upset with him because he started puttering around in the kitchen at 3 in the morning. His life expectancy is much shorter at this point, as far as I'm concerned. So I had to warn him to stop doing that. So with respect to sleep, naps are fantastic. But if you nap for more than 30 minutes at a time, or if you have multiple naps in a day, this can lead to disruption of your sleep cycle. So naps are good, but not too much. It's all in moderation. The other thing that happens is people start doing a lot of passive activities like watching TV. And passive activities are detrimental because they don't actively stimulate the frontal lobes as with social networking via the internet. It's not an interactive process. The frontal lobes are the neocortex. They're the newest part of the brain. It's only 2.5 million years old compared to the rest of the brain that we share with subhumans. And the frontal lobes are important because they allow you to pay attention. They allow you to register information that can be sent to the temporal lobes so you can form memory. The frontal lobes are also good because they allow you to multitask. I can tell you that female frontal lobes are much more intricately wired because they are so adept at doing multiple things at the same time. Men, it's football, baseball, beer, it's much more limited. And the frontal lobes also are your working memory, what's right and wrong, when should you take a shower, what fork to use. And I remember being in a series of video conferencing calls with a very, very important professional, and he intimated in the intimacy of Zoom that he's stopped showering. People started laughing, and he said, "How can you not shower?" He said, "Well, the day kind of loses its sense of timing and purpose, and this is a younger person, as you can imagine. The elderly start, they thrive on routine and structure and predictability, and when you lose the milestones of the day, it becomes an issue. So speaking of that, when people can't sleep, they start picking up a glass of wine, a bottle of beer, a shot of whiskey, and drinking alone is a very concerning thing. It's a recipe for disaster, and the social connection that you find when you go to a brew house with your friends is no longer part of the equation. Then we talk about loneliness. Loneliness is a major risk factor in the elderly for the development of depression, anxiety, and even dementia. So one of the situations that I found interesting when I started my first geriatric neuropsychiatry unit back in 2001 in Brockton at the Good Sam was that a lot of people in the community look so much to retiring, but none of them had actually planned what to do if they actually retired. So this concomitant loss of structure led to them having this floundering sense of existence. And I found a much higher incidence of dementia in people who retired, who had no hobbies, who had become socially isolated. So if you can magnify that tenfold, I mean, this is the situation that you're finding in the elderly, the risk of developing dementia because of the lack of appropriate stimulation of their brains becomes a major issue.
That's great. So one of the questions I want to spin off that you just talked about is how should people, you had mentioned hobbies, how should people be stimulating their brain? So it sounds like TV is not necessarily something that's going to provide that brain stimulation if we know that social isolation is necessary in protecting health. What can people be doing to maintain brain stimulation?
One is they have to set a routine every single day. And they have to wake up at the same time every single day, have their cup of coffee or decaf, and get showered and get rest. And what I ask people to do is to have 3 chores to do for that day, and to write the chores down and have a checkbox next to the item. There will be a nice sense of accomplishment knowing at the end of the day they've done it. Now, I don't want people to get overly enthusiastic and have 10 things to do, because the flip side of that is you can get distracted, and at the end of the day you find out that you have done just one thing and it gets carried over. So there's this sense of anxiety that you haven't accomplished what you wanted to do. So have low expectations, but reasonable expectations that you can accomplish every day. So you find that you have a sense of accomplishment. For those that are lucky enough to have a yard, this is the time to start gardening, start working on your grass, start doing some repair work at home. There's always something to do. And the other thing is, have a list of friends that you want to connect with every single day. You have friend A on Monday, friend B on Tuesday, friend C on Wednesday. Have someone that you make an appointment with to connect with that day. That sets the tone for each day and for the rest of the week. And by the way, you're doing it for them as well. You're reaching out to them is important because it makes them feel needed as well. Now remember, friendships need to be nurtured. They're going to die like everything else that you don't use. You have to nourish, you have to fertilize your friendships, and this is as good a time as any to do it. The other thing is exercise. If you can, walk. Just stay away from other people. Now, I have a mask on. Of course, I took it off because I'm in my office, but please wear your masks. Get your medical advice from medical professionals, not politicians. Politicians can be dangerous to your health. Now, Jen's smiling at me because she comes from a political family and she's always kicking me under the table when I say something politically incorrect. But I just want to make sure that people understand that the content experts for medical issues are in the medical field, not politicians.
Much appreciated. Okay. So you've done a nice job of helping us understand how we can integrate previous routines into a new normal, and how we can have or develop a new routine that is healthy and maintaining mental health and wellness. You and I have talked a lot in the past, and I think it would be really helpful to this conversation because it applies to seniors, but overall, I think everyone. I think it would be helpful to talk a little bit about strategies for maintaining good cognitive health and cognition. You had referenced dementia earlier. There's a couple of tips you've taught me that I've done since you've shared this around even just reviewing a dictionary every morning or finding a new vocabulary word every morning. Can you share some of those tips, knowing that there's other areas of deprivation, what we can do to be cognitively stimulated?
Well, it's one of the few pleasures that we have that we wish we always have time to do is reading. Reading a good old classic novel that you can borrow. You can borrow from your old library downstairs. Unfortunately, the physical libraries are not available anymore. But even better if you can seek help. Your elders can seek help from family members and setting up a Kindle account so they can read. Reading is a much more interactive way of living or experiencing a situation. It stimulates the frontal, parietal, visual cortices, and the temporal lobes better than just watching TV. It's something that people take for granted. It's something that is portable. You can do it. And frankly, we all have access to books that we've read in the past, probably decades ago, that we should probably reread. I also suggest that this is this activity can be an opportunity to start a virtual book club that people um, can basically start doing on a weekly, even every 2-week basis. Now, what I found from female patients is that females want something to talk about. So they respond well to book club-like interventions. Men tend to respond to an even simpler activity, which is to just connect. And men, unfortunately, do not have the luxury of watching a sports event together anymore. But that's not enough reason to stop them from just connecting. And I have a group of friends. Most of my friends are in their 60s and 70s. And we do our virtual happy hour via Zoom. And free Zoom is available for 40 minutes. So that's more than enough, but people look forward to it. And if, believe it or not, the first time we tried to do virtual happy hour, we spent 15 minutes trying to get people connected, which goes back to my earlier comment about older folks being not as technologically adept. That was profoundly soothing to my friends. And the other thing we do that's more of a daily thing is we have this text chat group. I actually nicknamed my virtual text chat group as vulnerable knuckleheads. I've always referred to our friends, my friends, as knuckleheads, but because of what's happening, they've become more vulnerable. So it's vulnerable knuckleheads, and that has been helpful.
So I very much appreciate opportunities to learn from you, because you live these recommendations. So I think the real life aspect is very helpful, because it's not just sharing information. I think you very much practice what you preach, and that's something that's I think very helpful for people to understand. So
remember, Jen, I'm part of the demographic. I'm part of the elderly age group, right?
So as you remind me quite often. So I think we might have a little time towards the end for some Q&A, but I had a couple of questions in the interim. If we were to kind of pull together some of the most important aspects of maintaining physical and mental health, one of the things that you highlighted is maintaining a routine. You had talked about stimulating activities like reading, as opposed to watching TV. Can we try to summarize what you find are the most important elements to integrate during this period of time, and then maybe talk a little bit about what are some of the common pitfalls in doing them?
Well, so one of the common pitfalls is that older folks feel like they're being a burden to their kids and grandkids, and as such, they are reluctant to reach out to them, even just to say hello. They always say the same. It is. I think it's something that they should do on a daily basis, even for 5 minutes. It also is soothing to their kids, because I talk to the kids as well, to know that dad or mom is doing okay. And a lot of times, dad and mom are isolated from their kids and grandkids because they're trying to mitigate exposure. The other thing that my elder cohort doesn't do is they don't reach out to their primary care physicians. Tele video conferencing is much more available now And we risk older patients dying from heart attacks or strokes or non-COVID-19 pneumonias because they're so afraid of reaching out for help. In fact, a lot of times people are coming to the emergency department much sicker because they've avoided it. So we now have emergency department physicians clamoring for the community to reach out earlier rather than later. I mean, there's an inherent danger of people dying first from a non-COVID-19 illness because of their trepidation towards getting help for their other medical problems. This is another thing that the elder generation tends to do. As we get older, we become rigid and stubborn, and we stick to doing the same old thing every single day. Remember, routines they soothe anxiety, so they do the same thing. I got a query from the girlfriend of one of my sons. Her parents live in Florida, and the question was, can we still play bridge with the folks in our condo community? And I said, probably not a good idea. And the comment was, we've been doing this every single day for the past 10 years. The other question was, can we get in the hot tub together with our neighbors? So we have to remind the elders to avoid those now so-called high-risk behaviors.
Got it. Okay. So there's there can be some inflexibility in significant changes to routines. And those might be some things to be more aware of.
Older folks have a discomfort with anything that's novel, anything that is not part of their daily routine. And it's something that sometimes is frustrating to their kids and grandkids.
Got it. That's very helpful.
You have to be aware of that.
So there was an interesting question that came up in the chat in response to something you had spoken about.
Did you see it?
I did, I saw it. I thought it was a great question, so I wanted to spin it off of what you had just spoken about. And I'm trying to summarize, so please correct me if I'm wrong. But I think the chat had said, if you have an interest in trying to divert attention from too much TV to do other activities that are stimulating, what's the best way to have that conversation in a gentle way with people that you care about? Did I?
Yeah, I think maybe it was from somebody who was addressing a senior who's watching too much television.
Well, I think the way you can think about that is that their loved one is filling a massive void in their day, right? So one behavioral intervention is to call them at exactly the time that they think their mother or father is watching TV and try to get them to do something online or via video, have a conversation via FaceTime. And you might risk your loved one being irritable with you, but at least it engages them. So in other words, don't wait for them to initiate it. They won't. You have to be the one to engage them in the activity. Remember, anything that's new is alien to them.
Would you recommend having a direct discussion about it, or trying to find ways to?
I would first try to develop what we in the field call a therapeutic alliance. And in this case, I would try to disengage their loved one from doing the same old thing by calling them frequently, even for 5 minutes at a time. You can't totally detox them from watching TV because you're not going to be living with them, right? And even if you did, you can't be with them 24/7. But at least try to engage them and maybe have a discussion with them about what they're worried about, what they saw on the news, then it becomes less passive, it becomes more interactive. Now, of course, there's always the risk that your father might be a conservative Republican, and this could lead to an interesting discussion. But as long as you don't get confrontational, sheer engagement, the sheer dialogue is more than enough to stimulate their brain. So
Excellent.
never confront them, never correct them, because that's one way to have them lose interest in social connections. They get very set in their ways.
That's a very helpful point. Can you speak a little bit more about that when you say never confront, or because that would probably create more conflict, that it's less about confrontation, more about trying to find alternative ways to connect. So can you talk a little bit more when you say they're not directly addressing it, because that might cause some resistance?
So remember when I talked about how the frontal lobes are involved, not just in allowing you to pay attention, but also to switch topics or discussions, in other words, to multitask. It becomes harder as you get older to get disengaged from doing something. You're stuck. And it's a neurological phenomena. And it happens even in people who do not have dementia. Of course, it's worse when you have dementia. So I'll give you a concrete example. If I have a patient that is stuck doing the same thing, like in this case, getting up, moving the chair, sitting down, moving the chair, it becomes this circuit in the brain that seems to be going haywire. There's no stop to it. So telling them verbally, please don't do that, makes no sense, because they're already in the routine. So what we try to do is we disengage them by giving them something else to do. So is there a good analogy for this?
Very helpful.
You disengage the elderly by giving them something else to think about.
Yes.
Changing the topic, as we used to say, right?
Yes. I'm sure there's a spectrum of what that looks like, and that's more, you're describing one that's possibly more extreme, but I think it's a great way of demonstrating the point that it really is about distraction and trying alternative ways to engage.
So more concretely, if they're watching something that you find probably not helpful to them, then you can probably say, what are you watching, Dad? And you can say, hey, why don't you try watching this movie? You can tell them about this classic movie that's on channel 903, for example. I'd rather they watch that than something that's potentially misinformative.
Got it. Okay.
Potentially something that's depressing to them as well, right?
Thank you.
That's one way to disengage them.
Okay.
And then you can say, why don't I call you and let's talk about that movie. I mean, and you can say, Mom really loved that movie way back when. So there's a way to weave it in.
Got it. Thank you. So this is incredibly helpful, and I appreciated that there was the question that was definitely a spin-off to some of the things we had talked about. So I wanted to put it out there to see if there were any other questions about maybe what you have spoken about, or questions that haven't been addressed yet as we pull the hour towards close.
So everybody's unmuted now, and then what I can do is go ahead and you can mute yourselves if you'd like to stay muted.
What? You unmuted?
So if there's a question they would ask.
They can either speak up or put it in the chat window.
I think you did a good job covering a lot. We don't have any questions coming out. But some may surface. So if there are any questions, now would be a good time to address it. If not, we can pull somewhat to a close. I know there's some information and resources that are going to be shared by Christina as a wrap up, and we can give her an opportunity to do that. Dr. Mendoza, if there's an interest in having some mental health supports, I know that Christina had mentioned Interface, which is an excellent resource. They really work hard to customize and match individuals with therapists, which I think is really important in ensuring that that therapeutic relationships work. And I'm a firm believer mental health isn't the absence of mental illness, that everybody in some way at some point would benefit from having those interventions. So do you have any recommendations for how people would access, other than Interface, how people might initiate getting mental health supports if that's something they were interested in?
So, I mean, I think the answer to that is the program that Jen had developed for me in Plymouth, where Jen developed a collaborative care program where our patients would reach out to their primary care physicians, who then would reach out to the embedded behavioral health clinician. I think that's probably as good as it gets in terms of getting people to talk about what's ailing them before it becomes an acute situation.
Excellent.
And remember what I said about not being afraid to reach out. What might be to you something mundane, like I'm just lonely, could be the beginnings of a significant depression, which can be profoundly debilitating. The other thing is, I'd rather that if you were starting to get concerned about your father becoming more confused or disoriented, that you get help sooner rather than later.
So early intervention is key
Mm-hmm.
and important to access supports as needed.
And for those that have loved ones who have dementia, the Alzheimer's Association is fantastic. I've worked closely with them for decades, and it's helpful. The other thing that we haven't talked about is the caregiver stress. The kids who take care of their parents who are older are stressed out profoundly by what's happening. They have the classic 36-hour day, right? Taking care of their parents and then coming home and taking care of their kids. Caregivers are under enormous amounts of stress during the pandemic.
Thank you. I did see another question.
Yeah, so the question was, what platform do you use for your group chats with the knuckleheads?
Oh, we're just using texting, regular texting.
And you can, and on your text message threads, you can identify a name for that group chat, for that text message. So you put a name on that text message thread with multiple people on it, which was called. Is that how you did it?
Yeah, that's exactly what I did. I mean, other platforms include Messenger, although a lot of people are concerned about Facebook and its security issues. Facebook, Viber is another way. WhatsApp. I mean, you're not discussing confidential information or national security interests, but it's just a way to keep on connecting with each other. And I like the notion that people could have something bugging them or something to share at 10 o'clock at night. There's no compelling reason for people to respond, although every once in a while somebody will respond. But there's this feeling that you're connected. And that's very soothing by itself.
That's a great suggestion. I have found a lot of people have really appreciated being part of those groups and networks. That's a great way to stay connected. Thank you so much, Dr. Mendoza. I can't tell you how much we appreciate this time. We're really extremely fortunate to have, I know how busy you are. We're extremely fortunate to have you participate in this. And I'm hoping that everyone found it as helpful as I did. I'm gonna let it kick off back to Christina. She's gonna try to pull it to a close and have some parting information. Okay,
Thank you, everyone, and thank you, Jen. It's good to see you again.
thank you.
Thank you so much. That was extremely informative. And just one last chance, if there's any additional questions, give everybody an opportunity. Well, I thank everybody for logging in and joining. This was the first time that we had done something like this, so we really didn't know how it was going to go, or if the need was there. And so I just really want to thank you guys for being a part of us trying something new. As I had mentioned, this is recorded, so we are going to be sharing this on our YouTube channel and other platforms. We always have, we have a lot of resources that we're putting out on our website, as well as our Facebook page. So if you do have access to Facebook, if you want to go ahead and like our page, every day we're trying to share uplifting stories or reach out and find ways to connect with people. We also, in terms of working out and getting exercise and staying active, we do have some other virtual options where, just like this, where you logged on to a Zoom, you would log on to a Zoom to take a class from one of our instructors throughout our whole association. Every day we have something either at 9 a.m. or at 6 p.m. And then lastly, everybody who signed up today, we're going to be sending you an email from the email that you use through the Eventbrite link that will have a very, very short survey, but will be a great way for us to capture, if we're able to do something like this again moving forward, what you really liked from it, if there's something that was missing, did you not like the length, or you'll have an opportunity to provide some feedback. So please look out for that via email. And again, I just thank you so much, Dr. Mendoza. Thank you so much, Jen. This has been so wonderful to pull you guys together, and thank you so much.
Thank you, guys.
Thank you.
Take care. Be safe.
Signing off.